My name is Dr. Richard Schoor. I am a urologist who specializes in male infertility, male reproductive medicine, microsurgery, and the vasectomy. The vasectomy is the safest, simplest, and least expensive form of birth control ever developed. There are no significant long-term side effects related to a vasectomy. In general, there are two types of vasectomy procedures. Actually, it's a modification of the same procedure. There's the traditional vasectomy procedure in which the doctor makes a scalpel opening on the skin and pulls up the vas deferens, snips it and cuts it. The no needle, no scalpel approach is a modification of that, in which we can numb the skin overlying the vas with a special sort of spray gun, and then we make a tiny puncture opening in the skin and pull the vas up through that little puncture opening. We perform the no needle, no scalpel vasectomy. The vas deferens is the tube that I cut during a vasectomy procedure. In general, the vasectomy procedure takes 10 to 20 minutes. Sometimes the procedure will be longer or shorter depending on anatomic variation within the patient. The vasectomy procedure itself is not painful, and most men describe it as mildly uncomfortable. After the procedure, you'll be a little bit sore, but certainly not in any severe pain. During the vasectomy procedure, all you will feel is pressure as I hold the vas deferens still. If you can tolerate this sensation during the examination, then you will have no problem during the actual procedure itself. Since the vasectomy procedure is performed under local anesthetic at our center, you can drive home after your procedure. For office or desk type work, you can go back to work the same day or the next day. For very strenuous physical work or for athletics, about 10 to 14 days. There are no sexual side effects that can result from a vasectomy. There is no change in the quality or the experience of sex or orgasm. There is no change in the amount of fluid that comes out, and there's no pain that will occur after ejaculation. You can resume sexual relations whenever you feel up to it, typically 3 to 4 days later. However, you must continue to use birth control until cleared to do so otherwise. In rare cases, the vas deferens after vasectomy can reconnect. This is called recanalization. If this occurs, it occurs after 6 weeks, but prior to 4 months. That is why I get one semen analysis to confirm that there are no sperm in the ejaculate 4 months after the vasectomy procedure. If that semen analysis shows no sperm, then you are cleared for unprotected intercourse. The vasectomy procedure can fail. Failure rates vary from 10% to less than 1 in 1,000. In this center, our failure rates are in the 1 in 1,000 range, which makes us amongst the lowest of any in the country. If the vasectomy procedure fails, sometimes it fixes itself. By this I mean, after repeated semen analyses, the sperm count will eventually go down to 0 with time. However, in rare cases, we have to redo the procedure. If the vasectomy was done here, then there is no charge for us to redo your vasectomy procedure. The most common complications to a vasectomy are mild skin separation and bruising at the vasectomy site and into the scrotum. The bruising and bleeding is very mild. The infection at the skin sites can happen as well, and surgical intervention to correct it is rarely, if ever, needed. Post-vasectomy pain syndrome occurs very rarely in men 10 years or more after a vasectomy. Men who experience this will complain of mild achiness or soreness in the vasectomy site or in the testicles themselves. It's a very rare condition. Usually it can be treated with medications. In very rare cases, men will require a vasectomy reversal to treat the condition. In the early 1990s, when PSA testing became prevalent in the urologic community, it appeared that there may be a link from vasectomies to prostate cancer. Subsequent studies and many studies over the years have proven this link to be not true. We do a vasectomy that is not totally destructive of the male reproductive tract. Destroying large segments of the vas deferens is simply unnecessary and does not make the vasectomy procedure any more effective. Because we do a vasectomy that is not totally destructive of the male reproductive tract, should you decide in 3, 5, 10 years to get it reversed, we can reverse it in a relatively straightforward fashion. While the vasectomy is considered a permanent form of birth control, we know from experience that 5% of men at some point will change their minds and ultimately go on to request a vasectomy reversal. In the hands of a skilled vasectomy reversal microsurgeon, success rates can exceed 90%. Typically, vasectomies are covered by insurance. However, insurance coverage will vary by the insurance policy. So if you want to find out if your policy is covered, please contact our office and ask for our insurance specialist. Spousal consent is not required to have a vasectomy performed. In fact, under the privacy law known as HIPAA, it is not legal to require to get spousal consent.